name's Ceile. I'm an admin for Natural Chaos, and today we are going to be talking about lidocaine. Lidocaine is something that has come up in our group in the past couple months, and there have been several posts that we have not allowed or that have been taken down. And today I'm just going to do an informative video just about the different types of lidocaine and the risks and dangers associated with lidocaine. So I hope you guys enjoy. Thanks. Alright, just some housekeeping before we begin. So this video is not to be taken as medical advice. It is for entertainment purposes only. And I also do not endorse, support, or promote any treatment or procedure done by any non-licensed or non-credentialed individual. And I also do not support, endorse, or promote use of any non-FDA approved products. And I would also like to remind everybody that practicing medicine without a license is a crime. So please keep that in mind. All right, so now on to lidocaine. Lidocaine can also be called xylocaine. So if you hear me referring to it as xylocaine, please know that I'm referring to lidocaine. So the way lidocaine works as a local numbing agent, it prevents the local neurons from signaling the brain. Therefore, the brain does not recognize pain to the area in which the lidocaine had been applied. For example, if I had arthritis in my elbow, I would apply aspartame with lidocaine to the elbow. The local neurons would not be able to signal the brain, hence the brain would not be able to recognize pain, resulting in reduced pain or no pain to the area. So why is lidocaine a preferred local numbing agent? The first reason is that there is a speedy onset of action. So what this means is I apply the lidocaine to my elbow. Shortly after application to the area, it's going to begin working by numbing. The second reason is that there's an intermediate duration of efficiency, and that is because the lidocaine is quickly metabolized. This results in numbing for a decent period of time, but not days and weeks on end. Another use for xylocaine is as an antidysrhythmic. So this works by blocking the sodium channels, resulting in decreasing the rate of contractions of the heart, meaning that the pumping of the heart is decreased. Please keep this in mind when we discuss potential side effects of lidocaine, and that'll be coming up shortly. There are numerous types of lidocaine available out on the market, some being over the counter and some being prescription only. And I'm going to talk a little bit about each of them. Lidocaine can be available in an IM injection, as an intravenous infusion, as a transdermal, as a topical, or as an inhalation. So with topical, that consists of our sprays and our viscous lidocaine. Use for a canker sore, if somebody has painful thrush, that's when viscous lidocaine would be used. Transdermal patches would be for temporary relief from arthritis, such as a salon pause patch applied to your back. Another form of lidocaine is an inhaled lidocaine. This can be a spray or some other aerosolized lidocaine. So an example of a use for this would be to help decrease the cough reflex and as a cough suppressant. So you would use this to reduce coughing and any subsequent tracheal damage caused by intubation when coming out of anesthesia. So if you're intubated, you're in surgery intubated, you're coming out of your anesthesia, you start to wake up and you realize you have a tube in your throat, you're gonna cough. So the lidocaine will help reduce that need to cough. Two types of side effects to keep in mind with use of lidocaine. One being side effects caused by systemic exposure, and the second being side effects caused by an allergic reaction to the lidocaine product used. The most serious of the side effects from lidocaine relate to administrative technique. This is really important. This is why we say no injectable lidocaine, because first off, you're not trained for it, and second off, I'm sure it's not a legit product if you're buying it online or somewhere else. Injectable lidocaine should only be provided by an experienced practitioner who knows the side effects, knows how to treat the side effects, and understands the dangers of using lidocaine as an injectable. They are trained how to properly administer it, and they can do it safely and in a controlled environment. So systemic exposure is caused when, for example, if lidocaine is to be injected in a subcutaneous manner and you actually hit a vein and get it into your bloodstream. That's systemic exposure, and there are some serious risks and side effects that can occur when systemic exposure occurs. So systemic exposure to excessive amounts of lidocaine can result in different central nervous system abnormalities. If you hear me refer to central nervous system as CNS, know that that stands for central nervous system, CNS. And it can also cause some significant cardiovascular issues, because remember we discussed how it is used as a sodium channel blocker for ventricular tachycardia, resulting in decreased heart contractions. Your heart slows down. So if you don't have tachycardia and you have lidocaine systemically in your body, you have the potential of decreasing your heart, which can be very, very dangerous. So the first thing I want to talk about is CNS, or central nervous system excitement. This is nervousness, feelings of impending doom, anxiety, that frazzled feeling, psychosis, hallucinations, hearing things, tasting things that aren't there, seeing things that aren't there, and potentially seizures. Another thing you have to keep in mind with lidocaine is central nervous system depression, or CNS depression. So this is when systemic lidocaine affects your central nervous system, resulting in depressed functioning. Now, your central nervous system is incredibly important, and it monitors the basic stuff in your body, so breathing being one of them. When that is depressed, your body's not gonna do the breathing thing, which is kind of important. So central nervous system depression can result in decreased respiratory rates. Typical respiratory rates can be anywhere between, 12 to 18 a minute. Everyone's different. 12 can be your normal, 18 can be your norm. When your central nervous system is depressed, that breathing, which you do automatically without thinking, is going to be depressed as well. So less breathing in and out means less oxygen. Less oxygen puts you at risk for ischemia, brain damage, tissue damage, potentially death. These are really serious things that you need to keep in mind. Some cardiovascular effects of lidocaine can be hypotension, irregular heart rhythms, bradycardia, or even cardiac arrest. Because again, remember we touched on use for ventricular tachycardia, the sodium channel blockers slows down the heart. Again, cardiovascular wise, your heart's getting slowed down. I also want to mention that lidocaine should be used with caution in the following individuals. So if you have hypotension, meaning low blood pressure, you want to be mindful, because again, it can cause central nervous system depression. And if you have low blood pressure, it could potentially go lower. Bradycardia. So if you have a slow heart rate, the drug lidocaine in your body systemically is going to cause decreased contractions, resulting in even worse bradycardia. Individuals with pseudocholinesterase deficiencies, so what that means, that is an inherited abnormality where you have sensitivity to certain anesthetic drugs. You definitely want to be mindful of any lidocaine use and discuss this with your provider beforehand. Lidocaine should also be used with extreme caution in individuals with porphyria, especially acute intermittent porphyria. And this is because lidocaine is a porphyrogenic, and that is due to the liver enzymes it causes in that individual. So what this can result in is severe mental changes such as anxiety, confusion, disorientation, hallucination, and paranoia. So some pretty severe mental health changes and just overall sickness to that individual. So the takeaway from this is injectable lidocaine only should be administered by a qualified practitioner, and it should be an FDA approved product. So please be mindful of that, because all of the potential side effects that we discussed can be caused from systemic exposure, which, for example, like I spoke about earlier, would be, you're injecting it subcutaneously and you actually get into, a vein. Therefore, goes into the bloodstream, it's systemic. And if it's a large amount, that can cause the severe side effects that we talked about. So please, please, please keep this in mind and, discuss with your practitioner, if you are receiving any form of injectable lidocaine, the potential risks associated with lidocaine. So if you have any questions about lidocaine, please leave them in the comments below and I will do my best to answer, or I will find the answer for you. But please keep in mind that I do not endorse use of non-FDA approved products and that I do not endorse or support any individual who does not have the credentialing or the licensure to provide these treatments or services. So I'm not going to tell you where you can buy injectable lidocaine. Sorry guys. But after this video, hopefully you won't want to do that ever, because it's super dangerous and it's something that only a experienced practitioner should do in a controlled environment. So again, thank you guys for watching and I'll see you next time. Bye.